We're joined by Jennifer Scaltrito. She is the Assistant Vice President of Social Services for RWJBarnabas Health's Behavioral Health Center on Route 9 in Toms River. May is Mental Health Awareness Month and has been since the 1940s. So we're pleased to have Jennifer join us here today. Jennifer, how are you?
Absolutely great. Thank you so much for inviting me, Greg.
And obviously, this May has been a lot different than basically every May since since Mental Health Awareness Month began, in the 1940s. Jennifer, first, tell us a little bit about the Behavioral Health Center there in Toms River. Where's the facility located? What services do you guys offer?
Okay, so as you know, that the RWJBarnabas Health Network is extensive throughout New Jersey. Our facility, which is the behavioral health facility, is located in Toms River, right on the corner of Route 9 and Church Road. We provide both inpatient and outpatient level of care, mental health, focused with working with adults primarily.
How long have you worked there?
12 years.
Wow.
12 years. I've called this place home for 12 years.
So it's not it's not a hospital, but it's just it's a separate facility, and people can just walk in, make an appointment. How does it work?
So essentially what we are is we're a behavioral health center. So we have 100-bed inpatient psychiatric services, as well as we have our Stepping Stones program, which offers individual therapy, medication management, and then we also have group sessions, family sessions that we provide as well. In regards to our inpatient treatment, essentially most of the folks that are referred to us for inpatient level of care do come from the medical facilities. With Stepping Stones, they can come walk in if they're looking for help, or they can give us a call on the phone. Our access center is available 24 hours at 800-300-0628. And they could get scheduled for a intake appointment with one of the social workers. Since this month is Mental Health Month, we have been offering also virtual mental health screenings on Wednesday and Thursday as well. On Wednesday, it's offered 12 to 6, and on Thursday, 9 to 12.
And how can folks go about participating in those?
They just call into our access center during the time frame. But if that time isn't appropriate, or say you're not available, you can call us anytime, because like I had mentioned, our access center is available 24 hours.
So, this period here since the quarantines really began about 10 weeks ago, 2.5 months ago, has obviously impacted all aspects of our society. How has the pandemic affected the ability of patients to get mental health services?
It definitely, I think the pandemic has impacted us all at many levels. Something as simple as going and getting a bottle of glue now takes 15 steps, right? I know this weekend I went to try to go to Michael's to just pick up a thing of glue, and I had to order it online, and then I had to drive up, call in, and all this. Mental health wise, we definitely adapted as a system. Originally, when COVID first began, I think all of us, mental health level, medical, every level, were like, okay, now what? It's been recommended that we social distance. So that essentially means if I was meeting with my therapist every week on one-on-one, I wouldn't be able to see her one-on-one anymore of going to her office. If I was going for support groups twice a week for grief, I wouldn't be able to go to those support groups anymore. So essentially what the mental health system has had to do is we have to adapt our services to where we're providing it virtually. A lot of the system has identified telecommunication platform where, I might meet with somebody for a session over the phone. Some of our folks that we work with here have webcams, and they're able to talk on a webcam, and some don't. So it's adapting the service based on the resources that the patient may have or the individual may have.
As this continues, and hopefully it'll wind down, we don't know. What do you see for the future of mental health services? As the pandemic rolls along.
I think that our services overall are going to continue to expand. There's been positives to COVID as well. I know historically some people were embarrassed, or there was a stigma attached to mental health, and they might feel uncomfortable walking into a therapist's office or walking into a psychiatrist's office saying, hey, listen, I need help for my depression. There are many folks I've come across the last few weeks where they are 65, 70 years old, and they've never reached out for help because they were embarrassed. Well, now they feel like, well, all I have to do is call and somebody's there to talk to me. I think it's going to continue to expand that, where people that normally wouldn't get help are going to be getting help. Not to mention, it's going to allow us to provide different levels of treatment in different avenues. I know a lot of the agencies, NAMI, the Mental Health Association of New Jersey, a lot of these different services provided to the mental health community now provide support groups virtually. And if you do not have a computer or you do not have an iPad or a smartphone, they provide a phone number that all you have to do is call in and listen. So I think essentially what's going to happen is we're going to adapt, just like we have in when I go to get glue, putting a mask on or ordering it online. I'm going to adapt to a different way. It's a new, I think of the key term right now, it's a new way.
You know, the pandemic has also impacted, you know, the lives of so many people, not just physically, but mentally. You know, people that are stuck at home, people that, you know, want to provide for their families, you know, go to work, all that sort of thing. And it's important, you know, as we've read and heard from experts all over the, you know, the news and these last few weeks, to, you know, do special things to help your own mental stability while you can, while you're at home. What are some of the simple self-care tips that you guys recommend?
Probably the number one tip would be develop a routine. A lot of people that I've been working with, where they've struggled is their routine. If before COVID, you would wake up every morning at 7 o'clock, open up your blinds, make a cup of coffee, you should still be doing that now in the middle of COVID. What I found is a lot of folks are, instead of waking up at 7 o'clock, they're staying up all night, watching movies all night, and then sleeping all day. I know I had a friend of mine had mentioned to me that their child is struggling with a routine since they're not going to school. So essentially what they're finding is their child sleeping all day and then they're up all night. It's extremely important to get a routine. And when I say routine, it's as simple as waking up at 7 o'clock, turning my coffee pot on, going and opening up my blinds, letting my dog out, taking a shower. You want to have a routine, because essentially what ends up happening is if you don't have a routine, you kind of feel lost. You don't feel like yourself. So that would definitely be my number one recommendation, is to identify a routine. Find an outlet. Find an outlet. A lot of folks that I've seen are really struggling because they can't go to the store. A lot of them like to go to the store, going to the library, going to the gym. You want to find other means of outlet. I have noticed a lot of folks have been working in their houses, painting. I know what I've done myself is I started to decide to start doing a vegetable garden. I had oregano for 24 hours and it already dried up and it's dead. But it doesn't matter whether or not you're successful at it. You want to find an outlet, develop hobbies, whether it be planning, coloring. I know a lot of people have been doing puzzles. Find different ways of an outlet. You want to avoid seeking outlets that wouldn't be so beneficial. Be mindful of your self-talk. I know a lot of times when people are watching news programs and you hear about, you know, people that are sick and loved ones that have passed away, sometimes we can absorb that negativity. And when we're on our own and we're kind of doing what we're doing, we start thinking very negative, like, oh, what if this happens to me? Oh my gosh, if I get sick, what's going to happen to my kids? It's all that negativity, and what we say to ourselves impacts our quality of our life. It impacts our mood. It impacts how we react to people. It impacts our decisions. So you want to be mindful of your self-talk, what you say to yourself. If you find yourself being consumed by negativity or being consumed by the anxiety, you want to definitely kind of check in. I think a lot of us, sometimes it's hard to say, no, I'm not okay. With all of the changes that have happened with our community and our lives, sometimes you just need to say, you know what? No, I'm not okay. I'm not okay with the fact that every time I leave the house, I need to wear a mask. You want to acknowledge that and say, you know what, I need help. And I think when it comes to the way we're social distancing and we're not having as much contact with people, sometimes it's other people that are telling us, hey, listen, you don't seem yourself. What's going on? Well, right now we don't have people to check in with us. So sometimes we have to check in with ourselves.
And you can check in with groups like you. We're talking with Jennifer Scaltrito. She's the Scaltrito. She's the Assistant Vice President of Social Services for RWJBarnabas Health's Behavioral Health Center. Jennifer, how can the public access your services and stay up to date on your programs?
Okay, so you can, as I had mentioned earlier, you can reach out to our Access Center at 800-300-0628. The Barnabas healthcare system as a whole has a website, as well as our website is www.rwjbh.org/behavioral health. And then we also have a Facebook page that we've launched out recently that's under RWJ Barnabas Behavioral Health. All you have to do is search it in your Facebook bar and you'll be able to find us right away.
Well, Jennifer, we appreciate a few minutes. Thank you so much. And I hope the fans got something out of what you had to say. It's so important this time. Continue to stay safe and keep up the great work. And hopefully we'll see you at a Blue Claws game here at some point.
Absolutely. Thank you very much, Greg. Have a nice day.
Thanks, Jennifer.